A space for conversation around women's health through the lens of naturopathic and Eastern medicine. I am Sandy Ross, and this is Herbal Medicine Podcast. This podcast is multi-leveled. Episodes for patient education to graduate practitioner level. Thank you for tuning in, and I hope you gain value from this episode. Welcome back for part 2 of our fertility support podcast with Michelle.
Thank you so much for having me.
Thanks for joining us again, Michelle. Now, for those of you who don't know Michelle, she's just done a part 1 on fertility support, so you can go and listen in to hear all about her beautiful journey and how she became a fertility specialist. But for this segment, we wanted to step it up a little bit for TCM student education. So anyone is welcome to listen into this, but this is more directed at, practitioners and students just wanting a little bit more of an outside perspective from someone who's been working with fertility for many years. So let's start by going into what do you think, Michelle, that TCM practitioners need to know outside of TCM for fertility treatments?
So for sure, it's important to learn about supplements because as Chinese medicine practitioners, we work a lot with herbs. However, when you're working with fertility, you're going to also be working with a lot of people going through medicated IVF, medicated IUI. And so, IVF is always medicated basically, and they give them hormone stimulations and shots. And as soon as they start any kind of hormonal stimulation, we stop herbals because herbals can interact or counter interact with, because as you know, like dangui, and there's certain ones that can impact hormones. So we don't want to do that because a lot of times with IVF, they want to control the cycle with herbal, with hormones. And they really do control the cycle. They'll stop the cycle, they'll control it very, very methodically. So in that circumstance, we need to know about supplements because supplements are something that they can do that can help. And there are a lot of supplements that would be silly not to use, like CoQ10, alpha-lipoic acid, or depending on what the circumstances, for certain types of people or diagnosis that can benefit egg quality. There's also certain supplements that can help with uterine lining. So they're wonderful to know about when you're working with people that are going through ART.
Yeah, great. What are some of the ones you use for, say, the uterine lining support?
So L-arginine is... I don't even know if I say it right, but I know to use it. L-arginine or L-arginine. So it basically, and then also CoQ10 is really good. So CoQ10 is great because it's good for both egg quality and uterine lining. And vitamin E is really good for uterine lining and L-arginine. And so the thing with L-arginine is it's been studied. A lot of people are back and forth about whether it helps egg health. So some people say it actually has an adverse effect. Some people say it really helps. But for me, if there's a question and there's so many supplements out there that are good for egg quality, why take it? Take that out of the equation. As soon as they do the retrieval, they have a bunch of embryos on ice, and we know that we have the embryos, and they're going into doing the transfer. That's when they can take it. So, it helps with the uterine lining.
Yeah, great.
Also magnesium over time. It takes a little longer, but yeah.
Oh yeah, magnesium for everyone.
Yeah, for everything.
What about egg quality? What are some of your go-to ones? Are you a fan for melatonin?
Well, it's been shown to actually to help if they are doing IVF. So for IVF only, but otherwise, I say try to make your body produce melatonin naturally by getting sunlight in the morning, because your body needs to know what time it is, and also not looking at screens right before going to sleep. Our light really impacts our own ability, our natural ability to have melatonin. Now, if you really want to do something, you can do tart cherry juice. it's a much more natural way, and it gets your body to have more melatonin.
Yeah, that's great. Thank you for touching on that. I actually heard the other day from Dr. Carrie Jones, who I'm sure you follow if you're into functional testing.
Yes, she's amazing.
And she was talking about the body only produces 0.3 milligrams a day, which is tiny compared to what we supplement. People take 5 milligrams. So we're talking 0.3, right? So if people are supplementing, they're supplementing at a dose that's way too high for what the body's used to. So as you said, those natural ways to support melatonin production is so much better because we don't need that much. We just need to support the body to do it. So thank you for touching on that. What about functional testing? What do you like to utilize there?
I love using Dutch. Interesting that you mentioned Carrie Jones. I actually had her on my podcast.
I saw that.
Yeah, she's wonderful. She's so interesting, and I have like a million questions for her all the time because she's just so interesting.
Yeah,
she knows so much. So Dutch testing, which is where she works, and it is really amazing. What I like about Dutch testing is that you're not only looking at the hormone levels, but you're also seeing what pathways the hormone takes. You also see melatonin, how much melatonin a person has, what their cortisol looks like. It's a pretty comprehensive panel, and it gives you a really beautiful map to understand it. And it's interesting because I've tested people with Hashimoto's or thyroid issues, and I see how they have a certain pattern on Dutch tests. So it's kind of an interesting thing. And then sometimes I've even tested people after they've done cycles, IVF, and they had too much estrogen.
Oh, wow.
So that's kind of something that I think a lot of people forget about. But what I do is when people go through the test, like after doing their cycle, I assist the liver naturally to detoxify and to also get lots of vegetable fiber to detoxify through the colon, all the different pathways to help the body eliminate, because we naturally don't have that much estrogen or hormones pumped into our bodies.
Yeah, great. It is an amazing test to do. And if you're first time looking at it, it can be very scary. Even as a naturopath, I was like, whoa. But there's just so much to it. It gives you so much information. It's amazing. It's great to be able to have all that information in one test. I'll just touch on, just in case some TCM practitioners are tuning in and they don't really know much about the hormone test. So the extra bonus of the Dutch, as you're saying, those metabolites of how their hormones excrete, that's gold, because it can tell us if it's going down a safe pathway, converting down the 2 or the 4 or the 16 hydroxy pathways. It tells us whether we need to give basic supplements like the DIM, which is from the broccoli extracts, or things to bind in the bowel to take it out. So that's really important. And some of those tests that we have here in Australia, they don't have that. You can add metabolites, but that has them all in one. So that's why the Dutch is such an amazing test.
But just wanted to mention, you're probably better off if somebody's trying to conceive and you are trying to help them like cleanse out, not using DIM, because DIM can really be very strong and it can actually decrease estrogen altogether. So things like broccoli sprouts can help detoxify estrogen a much more natural, like more easy way. And then even dandelion tea, to help the liver and things like that.
Yeah, that's such a good point. I actually love prescribing broccoli sprouts and getting people get them to get the seeds and sprout them themselves and use food as medicine, because they're really potent as a sprout. You can almost get you do have to eat quite a bit. They are. But, such an amazing food as medicine, obviously depending on what their estrogen levels are at. But thank you for mentioning that. Okay, so let's tune into maybe frequency of treatment for patients. So if you're seeing someone for fertility.
One more thing.
Yeah.
I'm sorry. One more thing that I wanted to mention about Dutch is because I'm talking to students or possibly practitioners, right? Some graduates. So if you guys are interested in doing Dutch, you could schedule calls with them. They have a lot of practitioners on board, and they'll walk you through everything to explain to you what you're seeing, what you could suggest. They don't suggest specific things, but they will talk to you about certain supplements, and they also have a guide. So just if you're interested in doing this, Don't get too overwhelmed, because it is overwhelming. Like you said, like when you first see it, it's intimidating, but it's actually, they really hold your hand through it as many times as you need to call.
Yeah, no, that's such a great point. I learned so much from technical support with every test that's available in the whole world, and that's the beauty of having that tech support there to really educate you. And it really does, you can do a webinar on something and you can listen into some of those things. But when you've got a case study in front of you, you really take it in.
Exactly.
So it's a perfect way to learn. Thanks for mentioning that. Okay, can we chat a little bit about frequency of treatment? So if a patient's coming to you for fertility, just so, potential students that want to dive into fertility or practitioners that are new to working with fertility can kind of have a concept of timeline, because, when you're first learning about this stuff, you get given you go to the textbook and it says do spleen 6 and spleen 10 and liver 3. For how long though, like where does things change and what's the duration and how often do you want to see them? Do you want to elaborate on that?
Yes. In the beginning, some of the people, if they have really, really complicated cases, twice a week is good. However, I've seen people once a week that have had complicated cases and they've done fine. It's just a matter of really being around, like sticking around for the program for a long time, like 3 months to really see a difference. So basically I treat mostly women, as I've mentioned before, and I treat based on phases of the month. It's interesting because I don't know about you, but like in my school, a lot of times they would say to avoid spleen 6 when a person's having their period because it can move too much. Have you ever heard that?
Yeah, but I do the Jane Littleton style, so a little bit different.
Exactly.
Too. Yeah.
No, it doesn't. So when I first took her course, that's when I learned that's actually a good thing to do. So school will say not to do that, but then her method of treatment and the whole philosophy behind it is to really shed the lining and to help the body shed the lining. That's why we do Tao Hang Si Wu Tang for phase 1, which is during the bleed, to really empty out and clean out the lining. Because if you think about it, when you're planting seeds, you want to really clean out the soil and prep it. So it's kind of the same thing. You really want to clean it out. You want to get it ready. And so you actually want to use those kind of things like blood movers, like spleen 10, and tonify basically spleen, which helps build the blood. And I do stomach. I don't stay away from there. I do Zigong almost all the time because I just feel like why miss an opportunity to do that? And then I do the 4 gates to kind of get the energy moving. And then a lot on the ears too. I do a lot of the ears. Supporting the liver, supporting the uterus, and then endocrine as well. So I'll do that depending on the phase of the cycle. So before and then after the bleed, right before ovulation, you could do ovaries, brain, endocrine, and Shen Men, just to kind of get everything like easy. And I also found that it was interesting because I went to a workshop where we put these little probes. It was almost like Easton, but on the skin, the stimulation, and it was supposed to stimulate right under the ear for your vagus nerve.
Vagus, yeah.
And I remember feeling really calm after that. And I really believe in working that for fertility. So one of the things that we think about is An Mian, it's right there in that area, and it helps sleep, probably because it stimulates the vagus nerve. So it's something that I actually do for my fertility patients, because one of the ways that people really do benefit from acupuncture is and I see this a lot of times in the beginning, some people will be really tense and they'll be uncomfortable sitting there for 25, 28 minutes or whatever. And then eventually they'll allow the session, they'll allow the treatment in, and they'll allow themselves to really ease into it. So I find that using those points, those spirit calming points, gets them there a lot faster.
Totally. Great point. I love that. I'm such a fan of the vagus nerve. I'm always telling my patients to gargle, to sing, to hum, to really get going, because it's so powerful. Okay, cool. Thanks so much for diving into that. Now you've just got me thinking about duration of treatments. Can you maybe chat a little bit about, now this is for the actual treatment, so how long?
Right, so needle retention.
Yeah, needle retention. And are you doing one side, both sides? Like how do you?
I do one side.
One side.
I do one side for at least 28 minutes.
28 minutes.
Sometimes I go over. Yeah, okay. Which is the cycle that it takes. Yeah.
Yeah. Okay. Awesome. All right. Thank you. And so, I mean, I find, I don't know, with your patients, but I find twice a week sometimes adds that bit of extra stress to patients, like trying to fit it in. So if they can't come twice a week, I mean, depending, obviously, if they're doing IVF and they've just come to you and the IVF is happening very soon, that's probably something you want to push for. But, you know, if they're doing natural cycle, maybe working on like endo or PCOS or something like that, just giving them, you know, doing the functional testing, the supplements or some herbs alongside, and then the lifestyle intervention, and then once a week, I find that works really well to just not create stress, because this is one thing that we're trying to like decrease with our fertility patients, isn't it? Is the extra stressors in life. So, I find that, you know, getting them on the table once a week and giving them all those extra things that you mentioned is so powerful and so supportive for their treatment. Okay, what's some of your most common diagnoses that you see in the clinic in females?
So I was thinking about that. I was looking at it before, and one of the most common diagnoses is, and it's not always like their actual pattern, but a lot of them tend to be kidney yang deficient.
Oh. Okay.
A lot of them also tend to be blood deficient.
Yeah.
So it's kind of like a combination. And there's the liver qi stagnation. I think everybody has that to some level. But a lot of them do really well with Moxa. And I find that when I have them check their basal body thermometer or temperature, they tend to be kind of like 96, 97, or their luteal phase is too short. It shows yang deficiency.
Yeah.
And so then I'll have them do Moxa at home, because I can't, I see them once a week and it's not enough. So I have them do Moxa at home. I have them do, Yuguiwan, just to kind of increase the yang. I like that formula because it's not too strong. It's like more of a balancing. And then we'll see, seeing how they're doing. I also have them do like hot water with lemon and sometimes adding cinnamon to it. So using spices to help increase that, and improve that. And what's interesting is after a couple of months, I will see their luteal phase increase and then their temperature go up. So it's pretty fascinating to actually watch.
It's awesome when you see that. Are you getting everyone to chart on basal body temperature?
No. But what I do is some people will do the Dutch test, which actually also checks progesterone. So you can see how they're doing as far as like if it's confirmed that they ovulated, or they could do the proof test, which also tests, it's kind of a urine test that checks to make sure that they have enough progesterone to show that they ovulated. And then also just listening to them, like, how do they feel? Do they feel cold? Is that something that they still feel? And then over time, when we do the Moxa for a little while, they actually start saying, I'm not as cold as I used to be. I'm not as freezing. Like, I don't need to always cover up. So that's where you monitor. But it's tough because not everybody, some people feel very stressed out by the basal body temperature.
Yeah, they do. Yeah. So you got to be selective with who you get to do it.
Exactly.
I'm surprised that it's kidney yang too that you see there a lot. I would be thinking, because it's such a warm climate. I mean, we see a lot of blood deficiency here and spleen deficiency, obviously liver stuff as well.
That too. I do see a lot of spleen deficiency, but a lot of people come in saying they're freezing, and then like I feel their stomachs and they're cold to the touch. But I mean, we're pumped with air conditioning everywhere we go. And people have, everybody has tile floors, and not everybody keeps their feet covered like we learn. So I don't know. It's interesting. Like a lot of people get really cold.
Yeah, that's a big point there with it. When it's hot, you're going to like do things to keep yourself cold, right? So everyone's probably on acai bowls and stuff as well, I would assume.
What's that?
everyone's probably consuming smoothies and acai bowls there, I would assume.
Exactly.
Trend
That's
here on
right.
the Gold Coast. We're like, stop the smoothies.
Yeah. Yeah. Cold water and,
Yeah.
all of that.
How about the moxa? So what is it, just an indirect stick you're getting your patients to do at home? What points are you, and how frequent are you getting them to use the moxa?
So I start out 3 times a week, depending on how cold they are. Like if they're not that cold, like 2 times a week, depending. And what I do is I send them home with a PDF, stomach 25, Ren 4, Ren 6, and also Zigong. And so kind of like that general area, I tell them don't get hung up on the exact points. You just really want to get that general area warm.
Okay, great.
And then sometimes stomach 36, depending on if they're deficient.
Yeah, okay. Do you do any particular phase of the cycle change the points, or is it sort of like here?
No, I just tell them around what happens around the time of menstruation. I just tell them to not do it.
Okay, perfect. All right. And how about herbal medicine? Are you using many particular formulas? Because you're a herbalist too, aren't you? Not just an acupuncturist.
I do. Yeah, I use herbs as well. And so I like to do the 4 phases. I like Blossom. I like the Jane Littleton's, Jade Moon is really amazing. All the different phases. And then I sometimes implement my own herbs as well. So I kind of use that as a base, depending on what they need. Sometimes they need regulate, invigorate, depending on what they need. And then sometimes I'll add another herbal formula that they would take outside of menstruation. With menstruation, I prefer to just do the phase 1 and really release and not add any tonics, which most of the time we want to give them. A lot of times it's either swing tonics or even Xiaoyao-san has some tonics. So I just keep it out of during menstruation because I want to just use the Tao Hung, Siwu Tang to kind of get things moving during that time. But Guipi Tang I find really, really beneficial. It's great for blood deficiency. A lot of times people can't have a hard time falling asleep. Sometimes they bleed a lot, like they bleed early and they're deficient. And so it's just a wonderful regulator as well. Like it really eases their anxiety as well. I love that formula. It's one of my favorites.
That's the best formula. And do you find like an extra bonus to the treatment if you didn't use the herbs? Do you think you'd be having to see the patients more frequent? Because this is something I think that some acupuncturists, they haven't delved into the herbal medicine just yet. And I find that when I use it in my treatment with my patients, it takes their treatment to the next level and they get results
for sure.
a lot faster.
Yeah, definitely. Without a doubt. I'm not sure. I mean, you would do, I think in general, doing twice a week is better than once a week if you can.
Yeah.
But I'm not sure. I mean, because it's just too. So if you can't do herbs, at least food or something, because I do feel that it's not a substitute for herbs per se. Like acupuncture really helps the body rebalance, but it's different. It doesn't substitute herbs because herbs works on a chemical level. And can so you could use supplements or food, diet to help those elements.
Yeah, I like to explain it like the acupuncture is the electrical system, and then as you said, the herbal and the food is like the chemicals, the building blocks. So we actually do need to put them into the body. After I graduated, I went and studied in China for 6 months, and in the hospital there, they do 3 or 4 treatments a week. So the duration of the treatments is so much more frequent, but they're paying like a few dollars for a treatment. They live close as many hospitals. So it's not like, and they don't have to take an hour out at least, because that's the thing. People are so short on time. That's what I'm saying. If they have to travel 30 minutes to the acupuncturist, then an hour on the treatment and then get home. This is where, we've kind of really adapted it to the Western sort of way of treating with Chinese medicine. And this is where some of those lifestyle prescriptions are so important to consider, like you talked about in the first part 1 of the podcast. So go and listen into that, guys. But do you want to maybe touch on some of those lifestyle prescriptions that you feel can be taken for fertility treatment that are so important?
Yeah, so what I mentioned was low inflammatory diet has been shown to be really great. So if you want to look at a really good prototype, look at the Mediterranean diet. So it's high in low in sugar, and it's just a really great, lots of wild fish, things like that. It's just a really great way to get the inflammation under control, because that typically is very much connected to to fertility. You don't Inflammation can impact implantation. Inflammation can impact PCOS, or PCOS already has inflammation. So you always want to decrease that. You want to decrease alcohol, you want to decrease sugar. Some people really want once in a while this or that. Once in a while is fine. It's not going to be the end of the world, but it's just good to really change the lifestyle and also the perspective. So instead of having the cookie, have berries, or kind of have alternatives that are also going to lower inflammation, because berries are great for that. They have tons of antioxidants, things like that. So you want them to kind of like get that under control as much as possible. And also breath work. So as we know, prana, chi, it's kind of related, and it's very much connected with oxygen. It's one of the ways that chi gets produced is oxygen. That's how ATP also in mitochondria gets their energy. So it's from glucose and oxygen. So doing breath work and really implementing almost like a breath yoga every day, going outside and really using our lungs capacity, going all the way in, all the way out. I love Wim Hof. I don't know if you've heard of him before.
Yeah,
but it really is a very, I mean, it's a little more extreme, but you could also pranayama and do lots of breath work to really utilize our lungs, belly breath. So using your diaphragm, not only does it calm you down, but it also makes you a lot more efficient in your oxygen intake. So utilizing that, basically, like, it's free and we have that ability, but we don't optimize it. So that's
yeah,
and also just writing down, journaling, getting together with friends and having a community and just expressing your emotions so that you can get it out of your system.
And you delved into the emotions in the part 1, so go and tune into that, guys, to hear some more on Michelle's take on the emotions. You mentioned Wim Hof. I'm always like, oh, don't do the ice baths for women.
Yeah,
I think,
true.
That's the worst thing for women.
Yeah.
But the breath.
No, the breath work. The breath. Yeah.
Yeah, definitely for the breath work. And I actually interviewed a lovely PhD student here. She went to the college I teach at. Now she's doing a PhD on, she's nutritional psychiatry for an intervention with the Mediterranean diet for treating young boys with depression, which is amazing. And she's getting such profound results. Yeah. So it was great that you touched on that. So if you want to hear more about the Mediterranean diet, go and listen to that podcast. And it's amazing.
Yeah, it's also an anti-stress.
Yeah.
It's anti-stress because you're getting all those omega-3s.
Oh, totally. I mean, it does so many things because you got all those polyphenols, you get the omega-3s, it's decreasing all that inflammation. It's a really good diet, especially for Westerners to take on, because you can still have some great things in your diet, right? You can still, I mean, if you're doing fertility treatment and trying to fall pregnant, obviously no alcohol and probably no caffeine too. Actually, that's something can we touch on? What's your take on caffeine in relation to?
So I didn't mention caffeine. I mean, yeah, it's best to avoid caffeine. I know that for some people it's more stress to give it up completely. So what I say is no more than a cup a day. But ideally, just even if they do have a cup a day, I say go to half a cup a day. And ideally, the less, the better.
Yeah, I'm pretty strict. I mean, I'm a nutritionist, so I'm like, that's it. You've got to cut it. But, I mean, weaning off it is a really important thing. It's quite acidic to the body as well, and it does utilize some of those minerals like the magnesium and the calcium and stuff to try and keep that blood more alkaline. So it's definitely one of those things I'm a bit more.
And it's not good for people with excess estrogen either. It actually increases it with people with fibroids or endometriosis. It's just,
and how it stimulates cortisol and anxiety. I think that's, we're kind of getting them on the table for the acupuncture to calm them down. So we want to take anything that's adding stress out of the body, and people feel okay. Like when they get over it, you're all right. You can do it. Okay, that's such great information. I think for any kind of new pracky that this is going to be pearls of wisdom to really get them going at being comfortable with supporting fertility. Are there any last things that you want to add on that are important to understand when working with women for fertility?
So one of the things that I've learned after a while is that women going through the fertility journey are really overwhelmed. They're getting a ton of information from doctors, lots of opinions from doctors, lots of opinions from family members, sometimes difficulties in the marriage. I mean, it's a very traumatic time in their life. And they've already, a lot of times, even by the time they come to me, they've already changed so much. So it's kind of like information overload. I just had a conversation with somebody actually who was calling. She's preparing for IVF, and we were just talking, and she said, I feel like it's information, or like everything that I'm like learning is information overload.
Yeah.
And I said, I know it's a lot. So I've learned to keep that in mind when I first initially speak to them, to not give them too much all at once, to really just be there to listen to them. I think that when you listen to somebody, they immediately get a healing. Like the healing starts when you start listening to them and they finally feel like they could talk to somebody that's going to help them. And I feel like already, that load or that feeling, that weight comes off their shoulder. So it's really important to ease them. It's all about little baby steps and not all at once. And a lot of times they already come to you feeling like a failure because of what they're going through, which is not true. It's not based in truth. And I try to, as much as I can, to reflect that to them, that they've done everything that they can. So I don't want to give them such a high level of like to-dos that if they don't go through that, they're going to feel more like a failure. So I really, especially in this field, it's really important to come at it with sensitivity and ease as much as possible.
Good point.
That's what I would say. Yeah.
Yeah, and that's the beauty of checking in with them once a week, right? You can just give them little bits of information and
Exactly.
It doesn't overload them. Are there any books that you recommend for patients or TED Talks that you recommend for them to watch?
I love the book It Starts with the Egg. It's just such a great book. It talks, the woman that's done it, she's gone through her own fertility challenges, and she's also, she's a researcher by trade. And so she basically researched every supplement, what works, what doesn't work, foods, diet, every condition. So it's a pretty amazing, all-encompassing book. But I also love Making Babies by Jill Blakeway, and also Yes, You Can Get Pregnant by Amy Raupp. There's a lot of like great ones out there. And
Definitely.
Spirit Babies, I haven't read it, but my patients swear by it.
Yeah.
I want to read it, but I hear amazing things about it.
I haven't heard of It Starts with an Egg, so that's great. I'm going to check that one out. So thank you for that.
Yeah.
Okay, Michelle, thanks so much for giving us this little snippet on what to do, kind of supporting fertility. It can be something that, it's exciting to work with women because you can do so much and you can really, like that transition of a woman coming in and helping them get pregnant, and then you might see them through their pregnancy and then you see the child. It's probably one of the most rewarding things that we do in our field.
It's amazing.
It's so good, and I work a lot with children too, so I really see that cycle. It's beautiful when you can follow it through, and you're right, like there can be so much stress and anxiety that comes with these women that we need to be the place of calm for them. So you've really touched on some great points there. So I just want to say a big thank you for taking the time out this morning from beautiful Florida and sharing your knowledge and wisdom with us today on the podcast.
Well, thank you so much, Sandy, for having me on. It's been awesome.
I didn't ask you, but where can our student practitioners, where can they find you? Because I know you've got a lovely podcast.
Yes, so they can reach me. They can find me at www.michelleoravitz.com. And I also do have a course or certification for fertility. A lot of times acupuncturists take it, naturopaths, anybody who has a basic knowledge of what they do, or people who want to do fertility coaching. And it goes over just all kinds of conditions, different treatments, also supplements, just like everything.
Wow, great. Okay, I'll be sure to check that out. Okay, well, thank you again so much for taking the time out and sharing your knowledge with us, Michelle. It's been great.
It's my pleasure. Thank you so much for having me.
Thank you for listening. I have been a practitioner of naturopathic and Chinese medicine for over a decade. I have a master's degree of health science and I am an academic lecturer at Australia's leading natural medicine college. I am available worldwide online for bookings. Simply go to sandyrothhealth.com.au.